welcome to yet another exciting episode on Idach TV's TV podcast. I'm your host, Renee Sakala. Today we're looking at a very important topic, and this is something to do with children's health. If you're a keen follower of Idach TV and everything that we do, you've observed that we've had so far 2 children who have cerebral palsy who have been treated currently in our health facilities. We had baby Gift, and now we have baby Felicitas with cerebral palsy. We'd like to find out what cerebral palsy is, and for us to get into the details of this disease or ailment, in the studio with me today is Dr. Hankombo, a family medicine doctor or registrar from Challenge Level 1, associated with Wellspring Hospital. Dr. Hankombo, welcome to the podcast.
Thank you so much.
So to kickstart our podcast today, what is cerebral palsy? Because if you, I think in your medical field, you must have come across people saying there are myths when it comes to cerebral palsy. People believe it's witchcraft. Mwana wanga wamulowa, mwana wanga sakula, no, mwana wanga hospitals banamsunge bwino, no. What is cerebral palsy, so that a mother out there can understand what is happening to their child?
Thank you. So cerebral palsy, or CP as we call it, this is a group of neurological disorders resulting from a permanent brain damage that is a developing brain. And this damage is permanent and non-progressive. So it happens early in life or early in childhood. It can also happen even before the child is born. There we have congenital abnormalities of the brain. So abnormalities that happen to the brain as the baby is developing. So we have seen quite a number of infections that are associated with that. For example, cytomegalovirus, syphilis. So we find that during antenatal care, this is what we are looking for in the mothers as they visit our facilities. During birth, what we call perinatal period. So there we pay attention to the progress of labor. We don't want labor to delay so much. So we encourage our mothers to come early to the hospital so that labor happens within the stipulated period of time. Otherwise, if we delay even a small part during delivery of the baby, that might lead to depletion of oxygen that is supposed to go to the brain of this baby before they come out to their mother. And just that short period of time can lead to permanent brain damage.
Is it possible to detect?
Yeah, so we're able to screen for congenital infections in a mother. Syphilis, for example, it's a very simple test. We can do it. We do it as the mother is walking into our antenatal care clinic. If the results are positive, we have medications to give them just there. So, in a situation where this brain is damaged, this child will not be able to control their muscle movements, including the muscles that are used to actually swallow, chew, or open their mouth. So, in a few weeks, I mentioned about the causes. So, say this is a child who's been eating just fine from birth, then they become sick again with an infection, say meningitis, or they develop yellowing of the body. All these can lead to damage of the brain. So when that happens, and now this child is unable to open their mouth to feed, what will happen in a few weeks or months after that is failure of this child to take in adequate food to prevent malnutrition. Over time, malnutrition develops, and that's how malnutrition sets in CP.
Okay, so what advice would you give a mother that has a child with cerebral palsy? What are some of the care routines that they can have in order to take extra care of that child?
So we may wish to know CP in our community. Not many people are aware about this disease. You find this child has developed this condition, and what the mother does is hand over this child to a grandparent who will always be there for this child. That is abandonment already. So you find there are a lot of myths associated with this. So mom will tell you, no, someone bewitched, or even grandma will tell you, no, this is witchcraft, without actually consulting us. So a few things a mother needs to take note is that early antenatal is very important, so that we can be able to pick infections that are preventable early enough in antenatal and treat them on time before they cause damage to this child. Timely antenatal and coming to our facility on time during birth or childbearing is also important. Remember, we talked about delay in delivery of the child. The child has to be born in a specific period of time, beyond which these complications are prone to happen. After the baby is born, the mother and the people around have to be very alert in terms of changes and say they are fit to be discharged. And they hand over the baby to the mother. But whilst at home, the mother has, and people surrounding this baby or helping in taking care of the baby, have a duty to take note of any changes in terms of feeding. Just poor feeding, change in feeding is a telltale sign for us. It's either the child is sick and we need to attend to them. Fever, most importantly, yellowing of the eyes, body. We have all the facilities in many of our high-level facilities that can test the level of yellowness or jaundice, as we call it, so that at a very early age we can detect whether that yellowness needs treatment or not. So those are things the mother needs to take note. If we attend to that on time, we prevent the damage to the brain that might come because of an infection or even the yellowness of the body. So you're saying we've made the diagnosis of CP,
yes,
and now we are cancelling the mother. So remember this, I mentioned that this disease can cause global damage to the brain. A lot of different parts of the brain can be damaged. That helps classify that baby in a specific group or type of CP. So there are different types of CP. So we can have one CP where the muscles of this child have too much power or hypertonic. So all they do is keep their arms stretched for a long time, never flexing or trying to release that tone. That's hypertonic. So each one has a specific treatment. So for the one who has too much tone, you need to find a way of releasing that tone or making it a bit normal. So we have medications this child is supposed to be taking to just reduce on the tone. Most importantly, the approach is supposed to be multidisciplinary. So this is, a mother can do this only after being taught on how to handle the child. So you start from us, make a diagnosis, we classify the patient, and then send you to a physiotherapist who teach you how to handle the tone of this baby, and if at all they need any medications to take. So it's not a one specialist job to manage a CP child. Mom also needs support. Okay, mom might be in a busy job, so leaving a child who can't move at home already predisposes them to developing other complications, like, for example, sores. So if a knee is left in one position for a very long time without tending this child, they'll develop a sore. Infection will go there, and that is what will kill the child in a short period of time.
How are the statistics of children being born with cerebral palsy in our country?
Yes, so documented statistics show that in the Western world, the incidence is a bit lower. So about 2 to 3 children in 1,000 births tend to have CP. Whilst in the African region, this tends to vary by country. So anywhere between 2 to 14 children born in 1,000 births So it's really variable, and these are figures that are prone to change as we advance with our healthcare system and provide more access to better delivery facilities.
Okay. Are there diseases or abnormalities in a child or baby should a mother look out for?
Yes, Rania. So, since we're talking about cerebral palsy, which is a neurological disorder, let me just say a few things about what we call hydrocephalus. In English, this is just an enlargement of the head that can be due to several causes. And then, in vernacular, is it Nyanja?
Yes.
Sekukula kwa moto. Yeah. So this can only be picked sometimes by the mother. Many of the times it's in proportion when it's overgrown. So it has become so big, bigger than at the time if a health practitioner examined this child earlier, they'd have picked it earlier. So you find antenatal becomes very important because there we are deliberately examining children for these conditions. So we measure the size of the head of the baby and compare it with the accepted size for that age. So like I said, sometimes mom will report it. For us, we're actively looking for normality in the size of the head, enlargement of the head. Remember, the baby's head still has spaces. People call them chimatuta.
Oh, yes.
Yeah, so those are spaces that become sealed as the baby is growing. So when we pick it as healthcare workers, that condition is easily managed by our pediatric neurosurgeon, sorry. So a pediatrician can examine, or any clinician, and if we find this condition, quickly refer this child on time to children's doctors or pediatricians. But then the problem in the community is that they're delaying in identifying this problem. By the time they come, the head is overgrown, and that growth damages the brain. Slowly, the brain thins out, and that leads to brain damage and can lead to what we are discussing, cerebral palsy.
Okay.
And benefits of treatment there at that time when it's overgrown are very minimal.
Is it curable if detected early? Is it possible to drain out the water? Is it possible for the brain to work normally?
Yeah, so what we do when we are treating that condition is not draining the fluid from the brain.
Okay.
We do a small procedure that leaves a tube inside, and the child can actually grow with that tube. What we're trying to do is prevent the fluid from damaging the brain when it overaccumulates. So damage happens as the fluid is pushing on the brain. That brain is thinning out. That thinning out causes loss of function of the brain. Yeah. So what we're essentially doing is just prevention of that. The accumulation cannot stop,
Okay.
but we want it to flow out as it is accumulated.
Okay.
So we are preparing to be pregnant, so we need to make sure there are no infections underlying that can affect the baby directly and leads to this CP.
The mothers that believe it's okay for them to give birth at home, no need for them to
Okay.
go to a health facility.
So remember, I'm in line with CP. I mentioned about being alert about the duration within which labor happens. That cannot be controlled in a home setup. So a baby born at home is prone to too many complications, not CP alone. Okay? And these are babies when they come in our facilities. We tend to keep longer to observe if there are other things that they will develop in the first 24 hours. Commonly, in a home setup, these are babies who are prone to develop sepsis. An infection of the blood that can still lead to a baby having CP if they develop meningitis as a result of that sepsis. So we are really strongly discouraging home deliveries. I think with time we have seen better access to delivery facilities in our communities. I think the mothers should take advantage of that. So UTH has a special unit for such children. The physiotherapist is able to give targeted therapy to them. Is it muscle strengthening? Is it stretching to control the contractures that develop over time? Or is it learning abilities that have to work on? Is it speech therapy? All those facilities are there in UTH. I think it might be the only center for now, but I think going forward, they might be looking at disseminating similar facilities to all centers.
Okay. Okay, thank you so much, Doctor, for coming through and enlightening our mothers out there, both expectant mothers and mothers who already have children with cerebral palsy, on what the causes are, the effects, and how best to prevent the disease. Thank you for according us with your time.
Thank you so much. Thank you to Idach TV for providing such a forum to the community. Thank you.
All right. Well, there you have it, our dear viewers. If you are a mother that is about to get pregnant, intending to get pregnant, please get checked. If you are pregnant, do not skip your antenatal. And if you have a child that has cerebral palsy, please do visit the UTH, University Teaching Hospital, that has a specific block for the kids so that you are advised. And you know, that's a burden removed from your shoulders, because you learn what your child is going through and how best to take care of your child. And you also get some counseling so that you know how to be mentally prepared and how to take care of your child. Let's take care of our children, both born and unborn children, so that we have a healthy Zambia. Thank you for watching.